Hip and knee replacement have some similarities and some differences. For both of those procedures, the commonality is that the procedure itself takes about an hour. People are able to walk right away, usually up and down stairs the day of the surgery, and then most patients are able to leave the day of the actual surgery itself. The surgery is a little bit different. Hip replacement is a simple ball and socket joint, and so the joint itself is deep and it's a simple joint, and so it tends to actually have less pain than a knee replacement, so the recovery is even faster. So it's very common for patients to be driving within days to weeks after a hip replacement. The majority of those patients leave that day of the surgery, and then they are up and mobile very quickly and able to return to work, usually within weeks. Knee replacement is a little bit more of a superficial joint, and it's a little more complex. So people tend to have a little more aches and pains with knee replacement. So the recovery with knee replacement, basically similar to a hip replacement, but takes a few weeks longer to get better. And there's a little bit of a difference between a partial knee replacement and a total knee replacement. A partial knee replacement, where we replace only part of the knee, that recovery is more like a total hip replacement. Patients kind of get up very quickly and have very minimal pain and back to work within weeks. Total knee replacement, a little bit bigger of a procedure in terms of recovery, and so it takes a few more weeks to get better and get back to driving than a hip replacement. Hip pain is a little more variable in terms of what the possibilities are. So that's one of the nice things about sort of seeing an expert in hip pathology, is that we can really figure out what the diagnosis is, because it's very common for people to think that they have a hip joint problem who come in who actually have a back problem or bursitis or sometimes even a hernia. So there's a lot of possibilities with pain around the hip region. Pain coming from the hip joint usually most commonly is in the deep groin area, so that's kind of a signal that there could be something going on in the hip joint. The knee is generally more focused, so people with knee pain or knee problems generally have pain around the knee, and if it's coming from around the knee, it is the knee joint. So the diagnosis of sort of knee pain is a little easier in terms of how to figure out what's going on, but there are still a lot of possibilities with the knee. You can have arthritis or meniscal tears or a lot of other pathology in the knee that can be the answers. The differential is definitely much broader with a hip problem. So again, the diagnosis and really making sure you're treating the right thing is important, because sometimes people will get down the wrong path where people will think it's the hip, but it's actually the back or vice versa, and they can start focusing on sort of the wrong problem. So really a diagnosis is key. The real issue you're solving with a hip and knee replacement is improvement in pain. So that's the biggest thing, and that's what I tell people. It's not to improve the cosmesis or cosmetic look of the extremity or anything like that. It's really getting rid of pain, which is really what people want. Once pain overtakes your body in a hip or a knee joint and you can't do things you want to do, you have problems with your function, you have problems with your quality of life that really make it so you can't enjoy vacations and time with your grandkids and just do normal day-to-day stuff that you would like to do. And so really it's an improvement in patients' pain, quality of life, and function. That's what we're able to solve with a joint replacement.